Tonight, if you get a headache, you'll reach for a pill and it will work. But what if it wasn't the pill? What if the thing that actually fixed you was a story your brain told itself, and the pill was just the prop? Your body has its own pharmacy inside it right now, capable of producing real measurable relief, real chemicals, real cures. And most of the time, it refuses to open unless it believes it. In 1944, an American anesthesiologist named Henry Beecher was treating wounded soldiers on the Italian front. The morphine had run out. A nurse, desperate, filled a syringe with saline solution and injected a dying soldier as if it were the real thing. Within minutes, he calmed down. His pain eased. He responded exactly like the men who had gotten the actual drug. Salt water has no pharmacological effect on pain. None. So what actually happened inside that soldier's body? Beecher couldn't explain it, but he never forgot it. When he returned from the war, he spent the rest of his career trying to understand what he'd seen. And in doing so, he gave medicine a word it still hasn't fully come to terms with: placebo. Here's where it gets stranger. Because a fake injection is one thing, a fake surgery is another. In 2002, orthopedic surgeon Bruce Moseley ran a study on patients with severe knee osteoarthritis. Some received a real arthroscopic surgery, a full procedure to clean out damaged cartilage. Others were wheeled into the same operating room, given the same anesthesia, and cut open with the same incisions, and the surgeon did nothing. He simply closed them back up. 2 years later, both groups reported the same reduction in pain, the same improvement in function. Patients who had a completely fake surgery walked better for years on a knee nobody actually fixed. This isn't a headache. This isn't a mood. This is torn cartilage, and belief moved it anyways. So what's actually happening in there? Neuroscientists have watched it happen in real time, using brain scans on patients given placebo painkillers. And here's the thing, it isn't imagination. When a patient believes relief is coming, their brain releases real opioids, the same natural painkillers your body makes during exercise or after an injury, real dopamine. Measurable physical chemicals, not a metaphor for feeling better. Your brain has a pharmacy stocked with some of the same tools sitting in a hospital cabinet. But it's locked behind one condition. It won't open the cabinet on its own. It only opens once it's convinced relief is already on its way. But why would a brain be built this way in the first place? Part of the answer is something as simple as learning. In the 1970s, psychologist Robert Ader was running a study on rats and accidentally conditioned their immune systems the same way Pavlov once conditioned a dog to drool at a bell. Pair a sweetened drink with a drug that suppresses immunity enough times, and eventually the sweetened drink alone suppresses the immune system. No drug required. Your body was quietly taking notes the whole time. White coat, needle, pill, hospital smell. Each one gets wired to the outcome that usually follows it. By the time you're an adult, decades of pairing taking medicine with getting better have trained your nervous system to treat the ritual itself as a trigger for relief. The same way a bell alone was enough for the dog. But conditioning is only half of it. There's a deeper theory, and it's a strange one. Some researchers argue your brain doesn't fully commit to healing itself all the time because healing is expensive. Inflammation, immune activity, tissue repair, all of it burns enormous amounts of energy. And for most of human history, energy was the one thing you couldn't afford to waste. So the brain acts like a cautious accountant. It holds some of its healing resources in reserve and only spends them fully when it's convinced the environment is safe enough to justify the cost, when a trusted healer is present, when the danger seems to be passing, when the story says help has arrived. A placebo doesn't create healing out of nothing. It gives your brain permission to stop rationing something it already had. But here's where it gets worse, because if belief can heal you, belief can also hurt you. And there's a name for that too, the nocebo effect. In multiple clinical trials, patients given nothing but a sugar pill and told it might cause nausea, dizziness, or headaches went on to develop those exact symptoms. Real physical illness from a substance that could not possibly cause it. Some patients in blood pressure drug trials have reported erectile dysfunction after being warned it was a possible side effect, at rates far higher than the group that was never told. Your body isn't just capable of healing on command. It's just as capable of getting sick on command. Belief isn't a bonus feature bolted onto your biology. It's a lever, and it swings in both directions because the same accountant that decides when to release relief can just as easily decide when to raise the alarm. And the size of that swing isn't fixed. Researchers have found that a more expensive placebo outperforms a cheap one. A capsule beats a tablet. 2 pills work better than one, even when both are sugar. An injection outperforms a pill, even though the actual ingredient inside is identical or non-existent. A doctor with a warm, confident bedside manner produces stronger placebo responses than one who seems rushed or unsure. None of that should matter to a body. A sugar pill is a sugar pill, whether it costs $1 or $100. But your brain isn't responding to the substance in your hand. It's responding to the story it's been told about that substance, and the more convincing the story, the more real the chemistry becomes. This is the same instinct that once read a healer's confidence or a tribe's ritual as evidence that the danger was actually being handled. You're not gullible for responding to it. You're running a system that kept your ancestors alive by trusting the right signals at the right time. So here's the uncomfortable part. If belief alone can trigger measurable healing in knees, in pain, in nausea, in blood pressure, why isn't it something doctors deliberately harness out in the open as part of real treatment? Some researchers are already trying, testing what they call open-label placebos, where patients are told up front, this is a sugar pill, and it still works, which means the story doesn't even need to be a lie to be effective.